This winter feels different. You have noticed it. People getting knocked out for weeks, not days. High fever, crushing fatigue, cough that just don't let go. It's not COVID. Tests are all negative. But it's also not a normal cold. And here is the truth most people aren't hearing. There is no mystery. The main respiratory viruses circulating right now in the UK, influenza, COVID, RSV, are constantly evolving every year. Combine that with waning immunity, colder weather, and more time indoors, and they are hitting people harder than we are used to. I am seeing this every day in my hospital and in my clinic. Normally healthy people wiped out for weeks. No clear answers, lots of bad advice online. Some of that advice outdated, ineffective, and in some cases genuinely dangerous. I am Dr. Suman Paul. I am a respiratory consultant working in the NHS and private practice in the UK. And I have spent over a decade treating respiratory infections through multiple flu seasons. And I can tell you, this season is different. Now, I am a doctor, but I am not your doctor. This is educational information. If you have severe symptoms, difficulty breathing, chest pain, or a persistent high fever, seek medical help immediately. But what I'm about to share is that exact 5-step framework I give my own patients to protect their lungs and keep them out of hospital. 5 steps, evidence-based, and you can start today. First, control your air. Most people don't realize the air inside their home can actually help viruses spread. When the air is dry, viral particles stay airborne longer. They travel farther and they infect more easily. But there is another problem. Dry air damages the lining of your nose and throat, your body's first line of defense against virus and bacteria. When that barrier dries out, viruses walk straight in. So here is the fix. Use a humidifier, especially in your bedroom. Aim for 40 to 60% humidity. You can check it with a cheap hygrometer. That range makes the environment hostile to viruses and helps your immune system do its job. Think of it as an invisible shield while you sleep. Second, nasal hygiene. Everyone washes their hands. Almost nobody washes their nose. That's a mistake. Your nose is where respiratory viruses land first. They don't start in your lungs, they start here. A simple saline nasal spray physically flushes out viral particles before they can settle and multiply. Nasal saline rinsing doesn't prevent infections, but it's safe and may help reduce viral load and symptoms in cold and COVID-19. Evidence is promising but not definitive. And here is the key. Use it before you are sick. At the end of the day, especially after crowded places, 2 sprays per nostril for 30 seconds. Any basic pharmacy saline spray works. You wash your hands after touching shared surfaces. Wash your nose after breathing shared air. Third, vitamin D. Vitamin C gets all the attention, but the evidence just isn't strong. Vitamin D, very different story. In UK winters, the sun isn't strong enough for your body to make it, and most adults become deficient without realizing. Low vitamin D levels are linked to higher rates of respiratory infection. Healthy levels help your immune system respond properly. The NHS recommendation is simple: 10 microgram or 400 international unit daily from October to March. If you are older, have darker skin, or spend most of your time indoors, this matters even more. Just don't megadose. More is not better. Fourth, smart daily habits. This sounds basic, but they work when done properly. Wash your hands properly, 30 seconds, soap and scrub. Ventilate your space. Open windows for 10 to 15 minutes a few times a day. Viruses love stagnant air. Stay home when you are sick. I know it's inconvenient, but it matters. The NHS advice is clear. Stay home until you have been fever free for 24 hours without any medications. And yes, masks still have a role. Crowded indoor spaces, public transport, high risk settings like a hospital, they protect you and the people around you. These habits are your foundation. And finally, the fifth is vaccine. Before anyone rushes to the comments, let me be clear. I am not here to argue, I am here to share what I see. I don't get paid to recommend vaccines, but I do see patients in hospital beds wishing they would had them. I see families devastated by preventable illness. I see long term lung damage that didn't need to happen. If you choose not to vaccinate, that's your choice. But misinformation puts vulnerable people at risk. The evidence is overwhelming. Vaccines save lives. Here is what actually matters this season: the flu vaccine, updated yearly. It cannot give you the flu and it significantly reduces severe illness and hospital admission. The updated COVID booster. COVID hasn't gone away. Boosters are targeted to those at higher risk and they reduce the chance of ICU admission. The RSV vaccine, new and often overlooked, available for adults 75 years and over and in some pregnant women in the UK. RSV can be just as dangerous as flu in older adults. And the pneumococcal vaccine. This one is critical. It protects against bacterial pneumonia, a common and dangerous complication after viral infections. Recommended for adults 65 years and over and anyone with chronic conditions like asthma, COPD, or even diabetes. These vaccines don't just protect you, they protect your parents, your grandchildren, your neighbor going through chemotherapy. This is about the community, not just individuals. So let's recap your 5-step fortress this winter. Control your air, 40 to 60% humidity. Nasal hygiene, daily saline spray. Vitamin D, 10 micrograms daily in winter. Smart habits, hygiene, ventilation, staying home when sick. And your medical shield, talk to your GP about your vaccines. If this video helped, like it so more people see evidence instead of the myths. Subscribe if you want clear, practical respiratory health advice. Protecting your health this winter isn't about panic, it's about having a plan. Now you have the same framework I give my patients. Stay informed, stay proactive. See you in the next video.